Hello, my name is Stephanie Ling. I'm an NIHR academic clinical lecturer at the University of Manchester. You're probably sick of me. I'm one of your EULAR TV reporters this year at EULAR Congress 2024 here in Vienna. So hopefully you've been watching our live stream of our remote care session. So I have with me all of our speakers today, and it's really great that they've taken the time to speak to us here on EULAR TV. So I'm just going to ask you all to introduce yourselves first. So first of all, Fer, can you introduce yourself?
Yes, thank you. I'm Fer Estevez. I came from University of Almería in Spain and also affiliated to Boston, Harvard University.
And Annette?
Yeah, my name is Annette de Thurah. I'm from Aarhus University Hospital in Denmark, where I work as a professor of health services research.
And finally, Rafa.
Yes, thank you. I'm Rafael Prieto. I'm an occupational therapist and researcher from the University of Almería in Spain.
Annette, I would like to ask you about maybe the first part of the session where we talked about sort of using remote care to maybe deliver interventions. So what's your experience of that, and can you give us any positive examples?
Yes, as you know, I was convener of the EULAR points to consider on remote care. So we know that there's a lot of evidence out there, and more is coming on especially rehabilitation interventions, but also day-to-day monitoring, especially within arthritis. And in our own group, we have developed intervention in rheumatoid arthritis, and we also have developed remote care interventions in patient education for rheumatoid arthritis.
Sure, and can you expand a bit more on maybe the interventions in the rheumatoid arthritis patients?
Yeah, it's basically a replacement of face-to-face contacts to the clinic, but in a way that we sort of screen patients beforehand and only get in contact with them in case they have a need, or we think they have a need. So it's based on patient-reported outcomes, electronically made by the patients, and then we sort of screen them afterwards and decide to contact them or not to contact them.
Okay, that's great. So, Rafa, can you maybe give us your experience of the more of the monitoring side of remote care then?
Yeah, well, I've been working in a project to monitor older people with a hip fracture, so we have been measuring for them like different patient-reported outcome measures during 3 months. So what we have been doing is to measure the functional status and the physical condition of them after providing a telerehabilitation program, including occupational therapy and physical activity. And it has been very difficult, as Annette mentioned during the session. It's really difficult, but at some point it's very interesting because it's like we were testing in maybe the worst sample to work with digital health. You know, older adults are not that used to get in digital health. So it has been very funny to do it.
Sure. And so one theme that's coming out from what both of you are saying, and actually from a lot of the sessions that I've been to this Congress, is the importance of personalization and individualization of care. So, Fer, do you have any comments on maybe how we can make remote care more personalized to each patient?
Yeah, actually we discussed a lot about it. It not needs to be yes or no. It could be also a combination. And when it goes to personalized care, we following the idea of René Heinen, we are doing network models in which you show different factors, symptoms and behavior, how they interconnect with each other. So we collect data for a month, 5 times a day, and then we came with this network for each patient. And then we can discuss with them in person, like, hey, these are your model, your interconnection between the nodes. What would you like to improve? How would you like to do it? And it's a way to personalize care, doing shared decision making.
Yeah, this is so great. It's really refreshing to hear about new takes because we've got the technology now, we've got the desire. So I'm feeling really positive, and it's just been like such an inspirational session to be at. So thank you, the three of you, for taking the time to speak to EULAR TV, and thank you very much for watching us on EULAR TV.